the latest advances in asthma, and there's lots of new things that are now coming into asthma care. One of the things is obviously a bronchoscopic treatment called thermoplasty, which means giving some through a bronchoscope, a camera is passed through the airways, and radio frequency waves are put in to make the mechanism is not very clear, but it appears that the smooth muscles which are hyperinflated are not any hyperinflated, and the patient does not have severe symptoms, do not require hospital admission. So that's a good move in asthma care, which is given through the bronchoscopic route. And quite a few trials have happened, and more work is also going on in this direction. The other thing which I have noticed in a few of the patients that I've looked after and shared care with some of the London hospitals is that a new thing that we are now using, especially in those patients who are steroid-dependent asthma. I did say that when other things don't work, the treatment we talked about, we need to give them steroid tablets, sometimes for 2 weeks, sometimes for longer use. These are prednisolone tablets. But some people who have got severe asthma do become dependent on these tablets. And it's very difficult because these steroid tablets have lots of side effects, including weight gain, thinning of the bones, thinning of the skin, indigestion, diabetes. So a lot of complications can happen when people are on tablet steroids. So I think it is vitally important that we try to get these patients off and identify what is making their asthma worse. So nowadays there are lots of biologic treatments that are also available for our patients, which could be given in the way of injections, and these are subcutaneous injections given some weeks apart. There are at least 4 or 5 biologics that are now available. It's quite expensive treatment and it's very new. It has to be closely monitored, closely supervised, but that would help those patients who have eosinophilic type of asthma and who have recurrent exacerbations, more than 2 or 3 exacerbations in the year, and also are steroid dependent. So the steroids could be slowly brought down, and they're given the biologic treatment to try to take them off the steroids, and explain the steroids have very harmful effects, especially when given in the form of tablets and on a very long run rather than a short course. So these are the directions that asthma care is now moving to. So there are these drugs which are injected subcutaneously, and some have different timings of them. Some are 2 weeks apart, and we try to give these agents and see how it helps the particular patients. There are about 4 or 5 biologics now available, which were never available before. So this is the latest advances in asthma care.